Oh,
You can't vote.
You're now live.
okay. So this is Senate Appropriations, and we're continuing our work on the budget adjustment. We have with us a number of witnesses from the administration, and some of it will be related to probably the Dear Jane letter that Commissioner Gresham might speak to, and the other is getting some testimony in terms of the worker retention appropriations that were put in by the House. And I know that there's been concern about how they would work in combination, making sure that we're getting what we need to have in place for the federal funding requirements. And so this is give you an opportunity to explain to us some of the problems that you see as it relates to the worker retention. The other point that I would bring out is we've had a number of emails from other provider groups with direct service workers who are not included. And I'll give you an example. The group homes that serve children in the custody of the state are not included, and yet the staff are working 24/7 with some of our most challenging youth. And there's a couple of other groups of employees, and I don't know what they will they will all add up to, but it's raised obviously some communications to us saying that there are other groups of employees that are being requested to benefit from the retention grants, whatever they might be. So I just wanted to let you know that as well. So Commissioner Gresham, are you lead? Is that the plan, or, and then
that is
you
the
can,
plan.
Okay. All right, great. Thank you.
I wanted to thank you, Madam Chair, and the committee for having us here. And since I do have the luxury of the presence of the people who put together our proposal and will actually carry it out, I figured I would just launch right into it. So to your point about the letter that we sent a couple days ago, one of the points we made is that the administration had put forward a straightforward healthcare workforce retention proposal. It was a total of $33 million. We used $18 million of the home and community-based services money for those providers, and we used $15 million of general fund for other providers. And the dual structure that was set up there, the dual funding structure, was intentional. And the House added to that two additional funding sources, ARPA, state fiscal recovery money, as well as Medicaid FMAP to the mix. As well, they added additional funding. And one of the points, or the point we made in the letter, is the administration is worried about operationalizing this construct. In addition, I think the House makes some changes and restrictions they put on to limit flexibility for employers. And, we just thought that the structure as well as the additional restrictions were unwise. So I thought it would probably be much more efficient use of time to, hand the floor over to Secretary Samuelson, who's here, and she can kind of, I think, provide better detail as to what we were saying in the letter.
Okay. Thank you.
You're welcome.
Chair, thank you for having us today. I'll primarily go through to answer the questions that the committee had put forward. And then I've also brought my colleague, the Director of Health Reform, Ina Backus, to answer any of the questions related to the way that the program will be administered. And I've brought Richard Donahue, who is the CFO for the agency, to answer any of the structural related questions. I want to start off by really pointing out that while we're talking about workforce development here, that the combination of emergent funds and the retention and recruitment funding allows AHS to address COVID-related needs of the health and human services systems. That we were really thoughtful about the size and the purpose of the funds. And as we look at the changes that have been made, we recognize that there's been an addition of the ARPA funds, but want to make sure that folks are aware that the proposed CRF funds that are in here really, as the governor has proposed, provide critical infrastructure such as housing and opportunities for employment for the individuals that the agency serves. They also provide workforce development initiatives that really create an environment that help us recruit and retain human services providers here in Vermont. So the repurposing of these funds really jeopardizes other areas of the agency. As we look into the COVID emergency relief funds and the changes there, we do request that we maintain the full $25 million with full flexibility for some really specific reasons. The carve out of the $5.3 million gross for the one-time increase to nursing homes for traveling nurses is unfeasible for a few reasons. First, the one-time funds cannot be used easily or at all to operationalize the increases. It will be difficult or impossible to operationalize that. Second, nursing homes can apply for and be granted funding through the extraordinary financial relief process, and some have already done this, as well as have received funding through the provider stabilization that's been available over the last year. They're also eligible providers under this emergency relief and can provide it. And our goal really is to keep the flexibility across all providers, because we know that not all of our nursing homes have experienced COVID in the same way. Some of them, through some of the programs that we've offered, are doing better than others. Traveling nurses that we've embedded, additional funding to augment beds that they currently have. And then also, some of them have received extraordinary financial relief and stabilization. So they're not all created equal. So we ask for the flexibility to pull them together with the other providers to really create a needs-based system. A portion of the traveler costs that they're requesting funding for are already reimbursed through their rates. And the rate setting process going forward includes an opportunity to include the increase in traveler costs in future rates. And so some of that will be addressed through the standardized rate setting process. If there's anything that we've learned from COVID is that it changes over time. Pinning funds that are intended to be flexible to respond gives us less fixed flexibility to respond to the changing needs that we can't anticipate. We know that there are going to be things that we don't know now, that we can't anticipate how we would use the funds. And so having that flexibility allows us to continue to respond to emergent needs. But we do know that there will continue to be workforce shortages. And our hope is that we can use these funds to address those shortages going forward, knowing that the provider mix of that may change over time. So rather than hemming in and making it less flexible. Related to the implementation of the relief funds, I want to remind folks that we have implemented the provider stabilization funds throughout the pandemic. We will use that same process, so we don't need to re-engineer a new process. In this case, organizations will submit a proposal to their departments of jurisdictions as they have under provider stabilization. Those departments will review those proposals and do a financial analysis on them. And based on that financial analysis, will assess whether existing fund sources that the departments have can be used. This allows us to leverage existing federal funds and opportunities to meet those programs' needs. It also, then based on their recommendations, they'll submit that to the agency, and the agency, based on their recommendations, will put out beneficiary agreements. Again, this is a vetted process that we've used for millions of dollars throughout the pandemic.
Secretary Samuelson, I suspect what we're seeing here is efforts on a variety of professional organizations advocating for different constituents. And certainly nursing homes, they have some ordinarily embedded and reflected in their rate, but they've actually had to spend a lot more money in order to, and even with that, they haven't been able to accept all the patients that need that level of care, and they're backing up in hospitals. So my question to you is, when the other body was taking testimony, did anyone from the agency, it seems to me what you're saying, rather than carving out X amount of money for this or money for that, that you have a rational process that was created when you put in the, and please correct me if I'm not giving it back right, the Provider Stabilization Fund. That allows all the applications to come and be thoroughly vetted. The need would be evaluated. The ability to match against federal sources would also be part of that examination. And that maybe you put X amount, maybe people say it should be more, but you don't want to create sort of this balkanization of responses from the different provider groups.
That is correct, and that's absolutely correct, Madam Chair.
Okay, now were you asked to testify in the House?
The agency was not. We testified originally? We did not provide testimony on the carve out. Okay.
You were asked to testify on.
We testified on the BAA initially and the use of the funds. We did not testify in the decision making process for the carve out.
Okay, so in other words, you went in. I mean, we all got the Agency of Human Services document, and that's what you're talking about. That was your testimony, and then you've got the page on the worker recruitment and retention.
That is correct.
And that's what you testified, not subsequently asked in terms of equity or administrative ease or having a structured process. I don't even know where the 5.3 million for carve out came from. That's why I was wondering if you testified regarding any of what we're seeing in the budget adjustment as passed.
We did not.
Okay,
yeah.
Thank you. I'm sorry to interrupt you, but I just wanted to just see if in fact you had made this, this presentation that you're giving to us and had an opportunity to express your thoughts about how the workforce recruitment and retention should be designed. Okay, thank you.
Yeah, no, thank you.
Committee, I'm just wondering, anyone on the committee have any questions or comments at this point? Otherwise, we'll just keep, yes, Senator Sears.
Well, quite frankly, I'm having a hard time following what's going on here. All I know is that these agencies are hurting, whether it's home health agencies, your group homes, your mental health centers, your nursing homes, they're all hurting, and they're hurting because they can't keep work staff. And their current employees are leaving in droves because of the difficulty of working with many of the clients or the difficulty of the working conditions during COVID. So many states, and it seems like the governor and the House all agree, there should be a program for worker retention. These are mostly good people who, have long history of working. I have no problem with putting a year's requirement, that they stay a year to get the full retention bonus that you put in this letter. But I think we got to keep it simple for these agencies. These are many cases are small agencies without huge staff, administrative staff. And this does seem complicated, what I'm trying to read in the House bill. But then once you list all these different organizations, you leave people out.
Yeah.
As Senator Kitchell said, the group homes that work with DCF kids, which have had added pressure because we don't have an alternative like Woodside or Newberry. And I've talked to the staff at those programs. I used to run one of those programs. So, and my wife's receiving aid from a home health agency. We were cut to 3 days a week because of the inability to attract new workers and retain old ones. We have a crisis right now. And I think we need to respond to that crisis in the easiest, most flexible way. I agree with you there, but you're losing me with all this talk about bifurcation and all this other
Yeah.
stuff. So
Oh.
I just want an easy way to get the money to the employer so they can retrain their good staff.
We thoroughly agree with you, Senator Sears. Those are great points. We also agree with you that the list that came out of the House does limit the providers that are eligible. The agency would propose an alternative list that expands that out further. And on that list would include the designated agencies and specialized services agencies. It would include residential homes that are outside of the designated agencies. So I would propose, and I can submit that to you, a much broader list for those agencies.
Yeah.
And again, we agree about simplification, and the provider stabilization process, we believe, was very straightforward for agencies and organizations to propose what their needs were. We continue to accept proposals even now, and consider how we would use this current proposal to stabilize those organizations.
Oh, good.
No.
Because
Senator
that's
Sears?
really what matters to me, is that we make it simple and that we get the money to the program so they can retain good staff.
Yep, that's very much what matters to the agency. We see that the human services infrastructure and the health infrastructure is at a pivotal point right now.
So let's write it that way, and let's,
Well, I think that's what they're trying to say to us is there at the beginning of the pandemic, we created this provider stabilization process.
Right.
And we moved out, I don't know how many millions of dollars, and it went to residential care facilities, to nursing homes, et cetera. And so that would, in other words, I think what they're saying is the process that's understood and worked to move money out to providers makes sense to continue using. Maybe we can say the amount available we think should be more than what is being provided by the administration. But
yeah,
the
I'm
others,
comfortable with a 60 million, for example.
well,
It's just,
yeah. Mhm. Okay. So, I just want to make sure that what we're saying is we want it simple and something that is understood. What you're saying is the provider stabilization process
Yes.
is understood, and it's as simple as you can make it. And your recommendation is to make sure that we are covering all the provider entities, not just those that have had an advocacy organization behind them. Like, we haven't heard from the group homes. And yet, certainly we know that the staff in those group homes are, they're working extra hours, and the kids that are there are really challenging. And you're like saying, well, why would they not be included? And then it raised the question, well, gee, are we missing any other kinds of providers? And that's something that I think the committee has really felt we wanted to be we did not want to sort of pick, you're the winner and you get it, and we didn't think of you and you don't get anything. So, or you didn't have somebody there at the table advocating for your need. And so that's, I think, what you're hearing here is the concern that we not leave anyone out.
Yeah, that is our concern, particularly because some of our smaller providers that we need in our system are the ones least likely to advocate for themselves. When it comes to the workforce retention, Madam Chair, if I can go there, program, that is proposed as a grant program, also needs-based, and we'd like to ensure that encompasses a broad set of providers. As currently proposed, with the braiding and blending of funding, it is not implementable. And I'll explain a little of why. The fund sources that we're talking about that originally were proposed coming into this, including the HCBS funds and the general fund source, those to the provider, it will look seamless, but there are some eligibility criteria to the HCBS funds. As proposed out of the House, we can't honor those federal requirements in terms of the way that funding is allocated. And so I want to be clear, as proposed, it's not implementable because we are going to do everything we can to make it upfront and seamless for our providers to not have to know whether they're an HCBS provider or a general fund provider. But behind the scenes, we will be working to make sure that we use the appropriate fund source. So I just want to make sure that that's clear, that as the retention fund is currently proposed, it's not feasible to implement.
Okay. I gather we're the ones to hear this for the first time.
It's definitely been provided back as in the technical memo, but yes.
Okay. So setting aside the amount, because we don't, I think our general feeling is as broad and as many individuals are in this workforce, and certainly the childcare people are a separate appropriation and a different subject. We have the 33, and they had kept the 18, I guess, in the House version. But what you're saying is that becomes problematic in the way it's done because of the eligibility criteria around the federal funding and knowing what their funding stream is. And then the other is the amount in total, 33 versus 60, which is obviously, that's a different issue. So even if we went and said, we'll concur with the House with the 60 million, this is a fairly large universe of employees. I don't know what the total number is, but I think it's quite a few.
Yes.
That this is provider stabilization system. Now, the stabilization was, a lot of it had to do with the loss of revenue, certainly to hospitals, because, you know, they weren't doing, they were keeping all the beds open for COVID and not doing, you know, certain medical procedures and so forth. Now, this is workforce recruitment and retention. So even though it was designed to be a stabilization process, you're saying it lends itself to supporting the funding for recruitment and retention.
There are two separate funds. There's the $25 million where there was a carve out of 5.3. That's for the stabilization. And then for the recruitment and retention, there was, as originally proposed, a $33 million, which includes a combination of HCBS and the $15 million additional funds, for a total of 33.
So, but you would use that same process that you have in place that was set up originally for stabilization.
For the $25 million, we would use the same process for stabilization. For the 33, we would use a streamlined grant process for administration of that funds.
So that would probably be similar to what we did with the hazard pay.
Yes.
Okay. We're quite familiar with that. That bill was done here in the Senate. And so that would be a grant process.
Correct.
Okay. Other questions of the committee? I know that staff, joint fiscal, trying to work out, you know, the funding streams and ultimately what the, you know, what the appropriations need to be. So, all right, I'll let you keep going. I'm sorry, I keep interrupting you, Secretary, but I just want to be, it's helpful to be clear that we understand your concerns, and making sure that we, do the right thing. So we have 33 million that you're talking about going out in grants.
Yes.
How did you determine how do you see, in other words, how do you determine the 33 million and how many grants and what would be the amount of the grants?
So the amount of the grants would be variable. They would be based on a need. Our proposal is that it would be a needs-based formula. We would look at prioritizing those who the organizations have experienced the most disruption in the continuity of services and maximize where they would create equity in our system. In terms of the scoring of that, we would ensure the most critical providers are able to meet the needs of Vermonters. We would look at the yield or the impact. So as an example, working to reduce wait lists for Vermonters, expanding occupancy. You can see that in some of our designated agencies, and supports to employers with the highest needs. So the highest vacancy rates are an example. We know that there are varying different salary amounts across the system between healthcare and human services. And so the amount that you would need to put in for a retention or bonus for different employees would be scaled based on some of their salary amounts. And so again, some flexibility in determining what those would be. That said, we want to ensure that there is equity, like that there is some level of equity. So we're not saying one hospital this week could do 5,000 and next week could do 10. So we would look to ensure some sort of equity in their proposals, and also put in provisions to look at limiting staff movement between organizations, because as Senator Sears said, we do see a lot of individuals moving between organizations, which is destabilizing the system. That would be in the grants as a form of agreement, that they would have an agreement with their employees about not moving between agencies, or potentially paying back those funds or dispersing those funds on a regular basis in order to create a retention similar to what we've done at the state hospital.
So Senator Westman, I see your hand is up.
So it's fairly clear where of the 33, the 18 is going. Who in what organizations I've been unclear about that the 15 was directed towards?
Yeah.
Of the 3.
The list that we would propose, and I don't have it separated out by which are the home and community-based services, Senator Westman, but I can run through that. We are proposing that it goes to hospitals, assisted living residents, nursing homes. Some of those are, as you already know, HCBS providers, residential care homes not operated by designated and specialized service agencies, home health agencies, designated and specialized service agencies, including shared living providers and residential care homes, substance use treatment providers that are currently funded through the Department of Health, recovery centers, independent and direct service workers, and therapeutic community residents. I'm sorry, I don't have it, so I can separate it out going forward, but that's the current proposed list of providers.
So in the bill that has come to us from and from what I've seen of what you and the administration has sent to us, that was the list that I thought was going with the 18. I have been unclear because it's delineated 18 and 15, and I've been unclear about the 15. So the 15 is going out, then what's the difference between the 18 and the 15?
Yeah, it's the one thing to note, Senator Westman, is that our home and community-based service providers also provide non-home and community-based services. I wonder, Ina, if you can speak to this a little bit more clearly from the technical perspective.
Sure. The home and community-based,
Ina, do you want to put yourself on record, please? Thank you.
Yes, thank you. Ina Backus, Director of Health Reform at the Agency of Human Services. Home and community-based services providers are providing certain services that are home and community-based in their designation, but those providers can also provide other services that are not designated as home and community-based services. I think an example here could be home health providers in particular.
And Ina, we can send back the list broken down by which are home and community-based service providers and which are not. And then
it sounds like behind this, you've got, as you're rolling it out, you've got some developed criteria. You were talking about, you know, how you you're prioritizing sort of the response. Hazard pay was easy. You work full-time, you got X. Part-time, you got X, you know, and this seems like it's much more variable. So, well, you say it is variable, so obviously it's much more variable. And so the criteria as it would relate to the highest vacancy rates or the wait list or the equity or the salary differential. That's how you would prioritize how the money went out. And there would be kind of a scoring then with this criteria. Is that how you would look at each application?
Yeah, you know, you've put some thought to this, so I wonder if you can provide a little bit more insight.
Thank you. Yes, that is how we would look at this application. Again, a needs-based program. When we first ran the Healthcare Provider Stabilization Grant Program at the Agency of Human Services, we fashioned that as a needs-based program and application process. It was not a first come, first serve program, but provided for an application starting date and end date so that all the applicants could be evaluated together to assess need and distribute funds accordingly. And we did that again with the Healthcare Provider Stabilization Fund. We also have this significant experience with administering the Hazard Pay Grant Program, and we would see those two experiences coming together here for the recruitment, retention, and training program. A little bit more of a streamlined application process to really be focusing on those areas of need in the staffing aspect for these eligible provider types.
So how did you arrive at the 15 with all this variation? It just seems like how did you arrive at that was the right amount? Or did you back into it? I have no idea. I was just wondering with this variable methodology, I guess you could say, well, we're going to appropriate X amount and we'll work within that box and score relatively to that box. But maybe it's more scientific than I'm rolling out.
That's a great question. And it's one that we've asked ourselves a number of times. So there were a couple of places that we've gained experience in this. Just before the end of 2021, we did an analysis across provider groups, particularly those among our designated mental health agencies, to gain some experience of how we might calculate it. And that's, I don't know if folks recall, but we distributed $2 million in funds to our designated agencies. Based on that experience and our experience with our experience that we had with the provider stabilization, some of which was retention and recruitment type of activities, and our experience with the Vermont Psychiatric Hospital, we did the math to begin to create an estimate. We also looked at what were the available funds. And I want to be clear, it was both based on a number of different experiences so that it was an informed decision, but it also looked at the availability of funds and the priorities that the state has to ensure that we continue to invest in things like housing, because that and the other workforce development activities, as the governor has proposed, so that we can ensure that we're not just shoring up the short term, but looking at the long term. So it was an informed process, but also looked at availability of funding.
Thank you. Committee, I'm looking to see if anyone has other questions. All right. Do you have more testimony? I'm sorry, we kind of asking in between.
No, Madam Chair, this was perfect. I think you got to them at all of the things that I was going to present in a way that I think was more informative for the committee. So I appreciate us pausing and going to what was most important to you.
Ina, you have any other comments or? Oh.
Thank
No,
you.
you don't feel compelled. I just want to make sure that you have an opportunity.
I do have a couple of other comments, yes, if I may. The program, as we have proposed, not only, as you've heard, provides for that needs-based assessment, but it also provides for a bit more flexibility in how employers might use funds. The employers may use funds in what we proposed for retention purposes. Also, if they have greatest need for recruitment, for instance, they may use the funds for recruitment bonuses. And also, if there are employers experiencing attrition due to, for instance, a training environment or a lack of folks to provide training, they may invest funds in training. And finally, we also recognize that employers are looking to recruit nurses and other staff internationally specifically, and that if this is the case, we wanted for these funds to be provided to potentially assist with those legal fees or other costs associated with international recruitment. So not only are we proposing in this program this assessment of need, we're also proposing then that the funds be a little bit more flexible for the employers rather than to be used only for the purpose of retention. However, we recognize that retention is a key issue, and we certainly expect that many program applicants would be prioritizing retention in this program. And finally, while our program is a needs-based program, it also couples the award with a expectation for continued service for the recipients of the bonuses, if that is the case. And we think that that's an important component of the program to have that service agreement requirement.
So I have a one question. Some of these provider groups are rate setted, and certainly the group homes are, nursing homes are rate setted. Do you see a difference between, because rate setting lags and then it gets caught up? So you have costs being incurred now that would get recognized the next time rate setting is undertaken. You have a kind of a convergence of rates that are based on prior year's cost that are out of whack with the current cost in terms of how you would see certain subsets of this provider group. Do you see that that rate setting structure is that those entities that are subject to rate setting need to be addressed differently?
Yes, but as you're referring to, folks will often hear us talk about them as PNMIs and the nursing homes. We are looking into that process right now, Senator Kitchell, and I would be remiss to say I have the final answer about what it would look like, but recognizing that over the last year, we've seen a significant change in both costs for staffing and personnel and supply chain costs. And so we're working with DIVA rate setting to look at the PNMIs, and then subsequently we'll look at the subacute rate setting process to see if we can better reflect the significant shifts that we've seen in a much more compressed period of time.
But
Senator Sears.
well, aren't these rate aren't these bonuses or some other form of remuneration that aren't part of the rate setting process? So they're over and above. They're not going to increase the base salary of someone. They are going to provide an incentive for them to stay for another year in that position or whatever you all decide. The only area that I'm concerned about is international recruiting gets a little bit, I don't know, that bothers me some. I'm not sure that's part of this whole problem. I suppose for, like, you want to get a doctor from Germany, I suppose is what you have in mind, or what do you mean by international recruiting?
Can home and community-based service dollars be used for that international recruiting? Is that an eligible cost?
I can't speak to whether that's specifically eligible with the home and community-based services funds, but within the I believe, and would defer to my colleagues, that the $15 million would allow.
I would hope that's left out of the plan, quite frankly. It just sounds to me like something that
I do know that a lot of hospitals for
this.
healthcare, they recruit from the Philippines, they recruit from.
I understand that, Senator, but we're talking about using money to retain people, and they're out recruiting people from wherever. And it just seems like this should be confined to the items that you discussed previously and not used for that purpose. It troubles me.
All right.
There may be you may want to put a special appropriation together for that purpose. But I'm taking money away from Vermonters who you want to keep on the job instead of them going to New York to the similar program over in New York or New Hampshire or wherever. That's, I thought, was the idea behind this, not to recruit people.
Well, we can talk about that. It's workforce recruitment and retention.
Yeah, well, I'd like to keep it workforce retention as much as possible.
Mm-hmm.
I mean, the heading of the letter to Senator Kitchell is healthcare workforce retention.
Well, but the slide in the agency's presentation is workforce recruitment and retention. So I guess the Secretary Clauser's letter was using a different heading than what the agency gave us in their testimony.
I'm just saying, I'd like to see 60 million go towards retention of the workforce and doing our best. And if it needs to be, training or something like that, that's certainly within the realm. But
all right, we have.
I don't think 37 million is enough in this environment. What did the governor say? 26,000 Vermonters have been lost to the workforce.
At 24,000 during COVID, and prior to COVID, another 6 or 7. So in a decade, we've lost almost 30,000 workers.
Yeah, and Commissioner Gresham, I think I would note that to meet our current workforce needs in Vermont, retention is going, particularly in the healthcare sphere, is going to be a critical element. Recruitment, is going to be a critical element, bringing individuals to Vermont and keeping them in Vermont. Our current workforce in Vermont will not meet the healthcare workforce needs.
Okay, well, we understand. I acutely understand that, since about a third of the workforce at our local hospital lives in New York.
Yeah, we're hoping we can get some folks to become Vermonters out of this as well.
Well, I mean, that has to do with the price of housing and other factors, but I think they should be two separate issues. If you want to fund recruitment, fund recruitment, but we need retention bonuses right away.
Yeah, since you brought up the SFR funds, Senator, if I may go back to something that I spoke to earlier. the House proposed $6 million of SFR funds into this. Again, that plus the Medicaid funds, braiding and blending that is going to make the program not feasible to implement and is not necessarily needed to implement the program as designed.
Well, in your earlier comment, you said the advantage of using the pre-existing stabilization system is that you figure out on the back end how to
What
leverage
funds?
the money.
Mhm.
So you're saying maybe by trying to be as precise with the appropriations, it could artificially constrain the ability to maximize all the potential sources of revenue.
That is correct.
All right. Any other comments? So the issue is, I think we're all saying the workforce is a real problem. We're well aware of the shortage. This committee has spent a lot of time and, understands particularly the report that was done on the nursing shortage, which is only one group of providers. I imagine respiratory therapists to child psychiatrists, the list goes on in terms of where we have significant shortages. One of the things that we've really tried to focus on is how do we expand the supply rather than just try to compete with everybody else with an adequate supply. And that's why we funded that partnership with the nursing homes and VTC, so that if you're an LNA and you want to move up, we're providing that kind of career path. And we're doing everything we can to expand the capacity of our nursing programs in our state college system, because all we're doing, as I've said, it's probably a not very polite way of saying it, but we're just throwing chum in the water for an inadequate supply of fish, and hoping that we're going to attract more than another state. And that does nothing to address the fundamental underlying problem of not having generating the supply of nurses that we need to meet the needs. So that to me, that's one of the other things as we're looking at this workforce and looking at the projections around that need, how we can take Vermonters and develop their skills and capacities in the areas where the workforce needs are most acute. And 10 years from now, it'll probably be a different sector for all I know in terms of shortages. So so that's just a struggle, recognizing this is short term, but longer term, we have really got to look at where those critical areas are and how we support and expand programs so that we can generate the number of workers that we need to satisfy the needs. So in some ways, I feel a little guilty about international recruitment because so many of those individuals are coming from very poor countries, and we're taking the most trained and educated staff, whether we're talking about Philippines or Pakistan or whatever. So I know it's done because the need is there. But we're meeting later on in terms of how we might figure this out. I think this helps. I certainly have a better understanding of the concern that you raise. The bottom line might be around the money, but the question is how to do it in a way that's simple, how to do it inclusive so that we're not leaving out a critical provider group, and that it can be done in a flexible and a fair way. I guess the other thing is, if we're recognizing that those rate-setted entities, whether it's PNMI or whether it's nursing homes, and you're talking about the rate setting and that as a parallel process, there's probably been an attempt to deal with that reality by trying to squeeze it in as a carve out on the provider side. So my question is, what's your timeline to deal with that rate setting that has, because of the rapidly changing financial and workforce scene is creating that problem system-wide.
Madam Chair, I don't have a specific timeline, but what I will say is that there are other processes that help to support that, including the request for extraordinary financial relief process.
Yeah.
So I don't have a specific timeline on it. We are currently working on it now. I can get back to you on what our timeline would be.
All right. Okay.
So, Madam Chair,
Yes, Commissioner.
just coming full circle, I mean, I think you'll see, I mean, and this conversation is kind of, in my mind, has been very helpful also listening. Yeah, I think you'll see that the administration and the legislature are more or less in lockstep on what needs to be done. It's just our concern is very much over operationalizing this, and we're just worried about being set up to fail. We want to make sure that what we, can do is what we know how to do best. So I think it's more a discussion, not so much over the need, it's just how to get it done. So we're glad you gave us a forum to give you our concerns.
Okay.
Thank you.
Well, it's been helpful to understand. I also think it's really important that you have an opportunity to explain what, because it gets into such complexity for us to really get a better handle on how the difficulties, or in your case, in some cases where it's just not feasible, as you're talking about some of the home and community-based services and how providers are, or if they're funded through multiple sources, which many of them are for different populations. So other committee questions? Okay, so I guess if there's anything, what we're dealing with is that we want it simple, we want it inclusive, and we want it fair.
I think we're in line.
Okay.
Thank you, Madam Chair.
Anything else you want to add, Commissioner Gresham, while have the pleasure of your company on a Friday afternoon?
Well, the hour is getting late. I think we actually have gone kind of around the horn on human services. I think you've heard us out, and I appreciate that. There are, a number of other issues that are on different topics. We've spoken about use of funds, I think, in the letter to the committee or to you. And that is something that is also concerning to us in terms of how the House went about their spending and the funds that they tapped. I'm happy to go into that, or we can leave that for another time.
Well, you're here and we're going to have to be making decisions. So I think this is your opportunity. I don't know, maybe the AHF staff want to get back to their other work, but because you're getting into just the use of general fund versus ARPA versus whatever. So why don't you use this as an opportunity to talk to us about one funding stream versus another.
So, and thank you for that. The administration, when they submitted their budget adjustment, there was a $75 million proposal in ARPA. It was entirely due to housing. Commissioner Hanford, I think, spoke articulately on the proposal there that went to Vermont Housing and Conservation Board, as well as VHIP and to VHFA. The remainder of the portfolio was focused in general fund and various initiatives. And, that was purposeful. The governor was looking to kind of silo the ARPA funds for longer term, 50 to 100 year type return that included housing, but also broadband and, infrastructure as he's laid out. And so we were a little concerned that the House, in their effort, I think, to set aside general fund for putting additional money into pensions, moved a number of our proposals into ARPA. Now, I will say outright, we're happy that they accepted many of those proposals, and we appreciate that. But we just thought it was not the best use of kind of once in a lifetime money to put in, for example, almost $13 million to shore up the unemployment insurance program, to put in almost $5 million to provide retention, state employee workforce retention and corrections, or the vets home. And this is not an argument over those proposals. We put them on there because we thought they were necessary. It's an argument about how we funded them. And we just thought ARPA should be, is a very unusual source of funds. Let's use it so that 50 years from now, when I go by a building, I could say that building was built with federal money, kind of like you can cross a bridge today still that was built in 1927. It's that type of funding that we were looking for. So we're frankly a little bit concerned. I mean, you know, there was almost $100 million of ARPA that was used for purposes that we just didn't think were in that bucket. And so we would be happy to work with the legislature, with the House and the Senate, to set aside money to the extent that they are looking to raise additional money for pensions. I would note, however, that we haven't seen the proposal yet in written form. We've seen the task force report, but we don't know what that proposal will be. But to the extent that there is a proposal that we can embrace, we're happy to work with the body to figure out a way to find that money. But I think the current plan is just worrying to us. It doesn't seem to use the source of funds that we have in the most opportune way. So that, I mean, if you read through the letter, you'll see there's a fair amount of that. There were a few proposals also that were what we would call kind of balance sheet cleanup that we would very much like the Senate to reconsider, notably calling $20 million of bonds and lowering our debt service, as well as shoring up a deficit in our property management fund. So, you know, those are major concerns. And in few cases are we arguing over the initiatives. In many cases, we're arguing over how they're funded. So we would, you know, ask the Senate to work with us.
And I think in some cases, you're asking to, in the budget that the governor signed, using ARPA funds, are now using the BAA as a mechanism to say, oh no, our preference is to use general fund. There are several areas of spending that are in that category.
That is correct. There's almost $48 million of ARPA funds that we're moving into general fund. Some of those were questioning eligibility. Not to say that they're definitely not eligible, but we're questioning them. That was on the community solar project, as well as some of the state technology issues. We do know that for the Vermont Housing and Finance Agency, that's a much better bet with general fund than ARPA funds due to the revolving loan structure they want to set up. So yes, there was also some swaps from ARPA into general fund that we proposed. But again, go ahead, sorry.
Okay. And then we had a subsequent request from VEIC saying they were in the same boat as Housing Finance Agency relative to the weatherization and wanting to switch ARPA to general fund.
Yeah, and we're not necessarily in agreement there. We know that, I mean, I think it's going to require some thought, which we're doing now. I don't, as of yesterday, they had not received an application from VEIC. I know it's forthcoming, but we are not convinced that it's not eligible. We don't know that.
Either 2 million or 5 million or all
I
seven?
think it's 5. I think it's 5.
Well, 2 million's workforce and 5 million is benefits.
That's correct. Yeah.
So their feeling was the benefits on their side were in the same boat as for Housing Finance Agency. And the workforce of 2 million, which I had raised a question, it seemed like it should be eligible because we're doing so much workforce and upskilling initiatives, which I would say in my mind is transformative. If we are getting people skilled and meeting workforce areas, that's sort of like the old GI Bill. We've got decades of benefit from those educational investments. So I'm not clear. Do you see?
I think the benefits, it was an income level.
Right. That's what it was.
That came out from the federal government that kind of caught us all by surprise.
Yes.
And again, the Deputy Secretary, Doug Farnham, thinks that there is still some possibility of some sunlight there. So we're not sure is the answer, but we don't think it's definitely a no.
Okay.
But there were some movements from ARPA back into general fund. Anyway, my main message is we're happy to work with you guys to the extent that we can agree on a need to find general fund. We're happy to work with the body to come up with that. We just don't think kind of putting some appropriations from general fund into ARPA is the way to do it. We would be more thoughtful about it.
Okay. Well, I think it's just a different approach to some extent, because the House has reserved a lot of general fund, 85 million, I believe, anticipating the need for match. And so as you're saying, the issue isn't so much about the need to the appropriation itself, it's the source of the revenue.
That's correct.
And exactly how you want to preserve your general fund, and how your definition of transformative might apply to how the ARPA is appropriated.
That's correct.
Yeah, okay. I think we have your message.
Thank you, Madam Chair. No, I appreciate the forum.
Yeah. All right. Any
Couple of
questions?
smaller things.
Yes. Oh, yes. Now that we've given you the podium, you might as well take advantage.
Yeah, I'm nice and comfortable. I could be here for a while.
Okay. Well, you have until 3 o'clock.
Oops. I don't quite have that much to say, but I just wanted to look also at CTE. We put in a proposal for $1.5 million. We funded it with Ed Fund dollars, which I would remind the committee is the way we always fund CTE. So we put in $1.5 million from the Ed Fund to give out to all 17 CTE centers. We're aware that the independents were not graced with ESSER money. However, we're willing to work with the body to make that whole. But in the meantime, we think many, if not all, of the CTE centers are in need of shoring up. So, and this goes along with, the governor is very concerned with CTE, and I know the chair is too. And so that is in there. The House reduced that to just the 3 independent CTEs. We would ask to move that back up to all of them. And we would also remind the committee that Ed Fund is typically the way they're funded. That would be an appropriate ARPA.
Well, that poses a number of questions, doesn't it? I don't know whether the House, the Ways and Means Committee in the House has certain strong, very strong views on how Ed Fund dollars are used. So I don't know
But
if that's
this is normal. We're not, this isn't correction, Community High School of Vermont here. These are CTE centers that are always funded with Ed. So I mean, I don't know. I mean, we're not asking them to switch funding sources. We're saying use the one we always use. So anyway.
Okay.
We leave that to you. And the final thing that I would say is there's also, and this is was my error, I take responsibility for this, is also the Agency of Education had asked for a appropriation to finish out their vaccine program for independent schools that are not eligible to receive ESSER funds. They were going to use ESSER funds for all schools. The independents can't receive ESSER funds. So they asked to for an appropriation to make that, they're already open and receiving applications. I think they've received 4 thus far, not a huge groundswell, but the deadline or the application period is still open. So I just wanted to.
And what was the cost on that?
150.
150.
It was pretty small, but yes.
I assume you, JFL, Stephanie, you're aware of that?
I am now.
Hey, it was in the letter, Stephanie.
It's in the letter?
I know that you take that to bed with you.
I did.
Oh, yes, right. It's your last paragraph. To support use. You can't imagine the volume of documents that we get. All of state government seems to end up on our table. We are obviously sympathetic. We think that, just because you were eligible to get it, then your LEA didn't give it to you, you're still ending up with nothing. So we are sympathetic to the centers that they're kind of supplicants, and their petition for money didn't materialize. So we didn't think that in some ways they were in the same spot as the independents as it related to the financial result. But yes, I see 150 to support the vaccine program. Okay. I'll put it right there with the moving of the New Haven train station.
The train station. Right.
Mhm.
Anyway, thank you for the audience. I appreciate it. This was a difficult bill to get across the finish line, which is maybe one reason why I forgot the vaccine program. It's
Well,
challenging.
Commissioner, with everything moving, if this is the only thing that got omitted, if it had a couple more zeros after it, it might be more of a problem, but I don't think it's probably something that we can't address.
Thank you.
Anything else?
I think we're good.
And we'll read your letter. I mean, I have it right here. It's just hard to keep everything straight. So, thank you.
You know where to find me if you have more.
Yeah, I do know where to find you. Anything else you want to ask the commissioner while we have the pleasure of his company? No, I guess not. Friday afternoon is a great time to come in, Commissioner.
That's right. I'll have to keep that in mind. Put me
Everybody's
on the
worn
agenda
out.
next time, Chrissy, please. Friday
Yeah.
afternoon.
Friday afternoon. So committee, it's now 2:12. Stephanie,
Yep.
can we close out some more money possibly, or
Sure.
language?
So what I have outstanding on the money pieces, I'll go back to cannabis board first. You agreed on 5 positions yesterday, on top of the 3 that the House put in. And so the report from the cannabis board is that those 8 positions, new positions, 2 of them, one would be a director, one would be a manager. So there's 2 that are sort of higher level positions in the slate of 8. The other 6 would be compliance type positions. The total cost for those above what you passed last May is $200,000 on top of what, so the cannabis board budget for 22 would be moving from 650 to 850.
Okay. And we had agreed that we would fund the 850 so that there was not a deficit for
And
22.
then you would transfer the general fund into that special fund so that
Yeah.
you don't create the
Yeah.
deficit.
Now, the next question is, do we have to create positions?
You do have to create the 5 positions. There'd be the 3 compliance and then the 1 compliance director and the policy manager, the policy director and the compliance manager.
All right, and we don't have the language yet on that.
No, but I'll have that drafted up and we'll have that for you. And we will actually create them as opposed to take them from the pool.
Yeah, okay, I think that makes sense. Otherwise, all we're doing is adding a new function and having it compete with the
We
workforce
have a
for
lot
what
of
we already.
vacancies in the state, but most of them are under recruitment, so they don't go
Yeah.
into the pool.
And they're needed to support the
Yeah.
work that we already have, not, so, all right, so we have language on that.
Yep. I wanted to just, on 2 other money pieces, I want to sort of confirm what you decided what I think you decided in the past few days, is that you would fund the deficit in the correctional industries special fund for 22.
Yes,
And that's 1.877 million, and that you would fund the state liability insurance total at 6.7 as opposed to the $5 million that the House.
I think we thought we would. We wanted to add it all up, but yes, we thought
Yeah.
that would make sense.
Okay.
Adam, you're listening to our deliberations.
Well, I came to apply. I was looking on Zoom. I'm better at Teams. I was looking for the applaud, the hands that applaud on Zoom, and I couldn't find them. But a couple of things. One, thank you for creating the positions for cannabis. I mean, we do have a position pool, but that would be a bit of a burden. And also, I appreciate the liability bump. That's a concern of ours, and I'm glad that I thank you for that.
We have a overriding desire to put our fiscal house in order and hope that whoever sits in our seats, 5 years from now, will find that they don't have to deal with some of the things that we've sort of had to deal with. So, all right.
Thank you.
I don't know where the applause button, and I hate Teams. They won't never admit me. They won't even let me join as a guest. I think I don't know. I think it's a plot.
No, it's
conspiracy.
Exclusive club, Madam Chair.
Yeah. Okay. So Stephanie, we've closed out that.
Yeah, just to follow up on what the commissioner was sort of explaining on the Efficiency Vermont weatherization piece. Sarah Clark in our office has been, having conversations with Douglas Farnham on this. And at this point, I'm not carrying a swap to the general fund for either piece because as I understand it, it's not the potential to actually have it covered is there. It just takes the documentation for those higher income eligibility groups to include there. So at the moment, the advice would be to leave it as an ARPA funded item, both the workforce and the grants, the weatherization benefit. And then if we have more refined numbers where a portion of the 5 million actually needs to be moved to general fund, you could do that in the big bill effective on passage.
Okay. And Chrissy just reminded me, Senator Campion's coming in at 2:45.
Yes.
Okay. So the portion, at least the portion that is ARPA eligible could flow out immediately.
On ARPA,
Yeah, and then anything else we could make effective when we get the
If you
big bill out in early May.
But my understanding for that 80 to 120 AMI segment, it's not that it's completely shut out. It's a matter of, and it's not the only program that faces that guidance change. But the feeling is that we will eventually get there, that will be an approved through the guidehouse process and with Treasury, an approved use.
Okay, all right.
And
Thank
then
you for following.
At the moment, I'm carrying the dairy in the ARPA column, the premium assistance. And I think there's just one more, the Ledge Council crowd needs to just sort of tie off and all agree that they think it's eligible as well. And I know Sarah, while you were talking earlier, was also following up with Douglas Farnham on that one. So unless we hear differently, that's where I'm carrying that $2.6 million.
Okay.
And then the only other money pieces, aside from what you want to do on retention, is this 150 for the independent schools vaccines. And then we have the 150 that we're carrying for the New Haven Railroad station move. And then the $500,000 for the Green Mountain Care Board benchmarking.
I think we agreed that we would do those. I had confirmation that Historic Preservation would pay $100,000, so it brought down the gap to 150. So that's to move the move the building, and the other one was the primary care alignment with Medicare.
Just to shy a little bit under $96,000 is what we're carrying on that.
We should be specific. We should be specific. We're not moving the building. The building's already been moved.
We're covering the cost.
We're covering the costs because
the cost came in. When you build a budget, you use an estimate, and it came in a bit higher.
Understood, but I think when we say we're moving the station, then it sounds like this will move the station, and it's already been moved, just didn't have enough money to move it. So they moved it.
Well, they moved it and they did that. They just didn't estimate the cost right.
Yeah,
They
well, maybe,
won't, and they won't
I guess they
unload
could,
it.
I guess
They
they could
won't
move it back,
unload.
Rich.
Yeah, but that would cost us again.
They aren't
All
gonna
right.
unload it and
Not
deliver
my
it until
railroad.
we pay them.
This is no way to run a railroad.
It's gotten
Uh.
stuck between Burlington and Rutland. They can't get to Bennington.
Where is Bennington anyway, Senator Sears?
It's somewhere south of Rutland, but
I get
you
it.
know,
I was really relieved though, when we saw where the apartments had been fixed up under the VHIP program.
oh,
that-
that's because, you know, the reason there's so many in Bennington is because we got left behind for so long. They had a lot to catch up on.
Wow, anything can be turned into victimization, even having the most projects.
Yeah,
Uh-huh.
well, you got.
Why don't you take credit for it, Senator Sears? But I guess
I'm
you
going
can
to.
since you didn't know him.
I'm going to. I suspect the next witness will take more credit for it than anyone.
Mhm.
He's gotta get above the fold again.
All right, Senator Sears, do you have anything more on Peru and Landgrove?
I do. We're gonna just wait. Yeah, it's complicated. Let's put it this way. It got more complicated as time's gone on, but when we have either a discussion about broadband money or the budget for 23, I think I can raise that issue and
Okay.
we can
All
have
right.
Clay make a proposal. There was money put aside for them supposedly, and I don't know what happened.
All right.
Unfortunately, should have gotten taken care of the budget adjustment, but the governor didn't put it in.
So it's still out there, but it will be dealt with in the 23 when
we have
get.
we'll either do it in 23 or if there's a separate broadband bill, we could do it in that. I don't know if there
Okay.
will be.
Okay.
The other open item I have is the recovery centers.
Well, the recovery centers, didn't they get something?
They would-
Already?
Their employees would have been
They're in the
eligible under
retention money.
Yeah.
the house's retention money.
I have an email back from the health department and Mr. Englander. I will forward that to you as soon as I get a chance. I'm on one screen here, so I need two screens to be able to forward and watch you guys at the same.
So they would be part of the retention. That's absolutely correct. So the question is, what would be their unmet cost or need other than just give them a grant to
Right.
improve their facilities or something? I don't know. Okay.
So that's my list on the money side of things. And so before we talk about changing anything on the retention, if we are changing anything on the funding streams, I have you spending, or in total, not spending, but allocating $5.322 million higher than what the House has allocated for general fund. This is just the general fund. And then from, I don't know if the committee wants to take the next 20 minutes to sort of discuss what you want for the retention program to be included in the bill. It would be helpful to staff to hear your thoughts, given what the House has passed. And I just want to say that the House intention was not to braid funding. They had a very limited list, a defined list of providers. And they were trying to match up funding by provider in terms of the Medicaid piece, and then leaving basically the ARPA and the home and community base because the providers would fit into either one of those. So it was the independent care and the shared home living that was going to fall into the Medicaid stream of funding that they appropriated at their $3,000 per person
Well,
estimate.
First of all, we have to make it clear, and they did say to prorate, because obviously
Okay.
this committee and I think there's pretty much universal agreement that we want to include all those direct care personnel. And that gets away from, the categories, getting those categories. Although certainly for the those that are eligible for that FMAP bump, what they're saying is they can do that behind the scenes.
Yeah.
So rather than attempting to do it, so much of it is done based on the individual provider and the line of business and how much is just, would fall into that higher enhanced match and that would not. So you're going to meet with them, Stephanie, on that?
Well,
Or are we having?
We've had some conversation. We have not on the retention specifically yet. It would be helpful to have guidance from this committee on what I heard is that the House as it's proposed is much more similar to the hazard pay than the needs assessed proposal that you just heard from the administration. And so I think your staff would love to have what the we understand you want the broad ability for the slate of providers, and I want to understand if that includes hospitals and the clinics in the retention specifically, in the retention pot specifically, FQHCs, because that's a much higher group of employees. And then how do you view it as the way the administration would by having whatever their internal prioritization and needs assessment is, or are you looking to disperse money in a way that is similar to the House?
I'm really struggling with this, Stephanie. My first
They all have enhancements to the case G series wheel loaders are built to
what? Because this is kind of a discussion I wish our Health and Welfare Committee should have, because I do think that they may have a position on it. I need to probably talk to the chair. They're a morning committee, and maybe they can give us with some background. Yes, I guess we're getting into fundamental hazard pay. We didn't differentiate the condition and of the provider. We just said, we're giving it to you because of hazard pay, because of the nature of the job you're doing, the risk that you're at elevated risk. The purpose of this is to, and what I think there, and I think that there's merit to it, is saying when you're getting into retention and when you're getting into the payments, just like everybody in state government, corrections got treated differently than some other employees, for example, because of the nature of the job, the acuteness of the shortage, forced overtime, et cetera. So it seems like what the agency is attempting to do is to make these funds go out in a much more strategic way to address the individual kind of circumstances that the different providers might have. And so I think that's one of the, yes, we can talk about it in the context of hazard pay and everybody shall get a payment, but this isn't what this is for. It's retention and recruitment. And so does that lend itself to looking at a much more application specific review against established criteria, which is really what they're talking about, so that the help you get is indexed more to your particular need and circumstances.
Would this be going to just full-time employees for
No.
retention?
No. they would move it out based on full-time equivalents, but no, part-time, we asked that question. It could be for part-time workers as well.
I'm
And-
fine on having it based by need. I have a little concern about adding hospitals in. 'Cause that would eat the whole thing. There'll be nothing left.
Okay. So you're looking at the entities that have really the fewest resources at their command to help address their workforce needs.
So.
Yeah. The
Like
the
we
ones
all-
that, yeah, and I don't need the list the House did, but I do, and I do agree with the administration on making it based on the greatest need, but I just am worried about adding hospitals, that's all.
Well, haven't hospitals already received a large amount of money?
Well, they got money in the
Well,
stabilization. That was,
Right.
but this is workforce and retention.
Well,
But,
how do you?
but wait a minute, but don't forget, we've got two buckets of money. We've got the 25 million stabilization, and then we've got, so is the 60 million the combination of both the 25 stabilization?
No, the 25 million general fund stabilization is distinct from the retention. So that is, the 25 million general fund healthcare stabilization is included, it was recommended by the governor and is included at that level, at that funding source. There's no change between the House and except for the carve out for the nursing homes. So the decision in the 25 million stabilization is whether or not you carve out 5 million of that to provide higher rates to address traveling nurses specifically for nursing homes. So that's the question, but it's a distinct box from the 60 million.
Okay, so the 60 million is simply workforce recruitment and retention, and the
And the House
administration.
it was only retention. There was no contemplation of recruitment.
Okay. Okay, it was only retention.
Yeah.
So the 5 million will be going to the nursing homes to cover their costs of traveling nurses.
In the House's proposal, that's what would happen. The governor did not have that carve out. He would do the same needs assessment and identify who needs, in that the administration would do the same, prioritization. What the House is doing is prioritizing 5 million to be matched up to turn into 12 million to go specifically to the nursing homes.
So it would be 12 in total or 17?
12 in total for the nursing homes, but 5 of it, since the $25 million pot is general fund, you would take out 5 and some change, and then you would match that with Medicaid dollars. And that's how the 5 and change turns into 12.
Most of these nursing homes are owned by out-of-state companies. I mean, I don't know about that whole deal.
So the administration is not recommending the carve out. They're
Right.
feeling that they could deal with the individual nursing home costs through the stabilization, just as part of that stabilization.
Yeah, and they could, and they can, because that $25 million pot is general fund, they can direct it through Medicaid and draw the match where appropriate.
Mhm.
That makes more sense, doesn't it, Jane?
Well, in some ways it does. I do know that the nursing homes feel that they've been really hard hit and rate setting has bothered them. So if we had a better commitment of when they were going to go in and do the adjustments to the rates, but it does seem like that higher cost should be recognized through stabilization, just through the process. I guess the question then becomes one of the minute you start carving out traveling nurse costs, then we start getting the VNAs and we get other entities
Yeah,
that are
it's just-
saying, we've got travelers here too, and they're costing a lot of money. So if you're attempting to deal with the cost of the travelers in one
across
provider
all-
group, then the other provider groups are already coming in saying, we should have our costs recognized too.
Yeah, they're over, the VNAs are about $1 million short on the cost of the travelers for nursing.
Well, we've heard from them as well.
And they could apply to this, to stabilization for that need. It's just that they don't have a defined amount within the,
But I think they all should be in the same bucket. I mean, here we are creating separate
Okay.
buckets of money
Okay.
for different, unless you guys think differently,
Well, it
that
poses,
create,
it in some ways, it leads into the same dilemma that we have with the retention groups and who's in and who isn't, so to speak.
Yep.
On the other hand, I know that the nursing homes have obviously the cost of travelers has been a real problem, and hiring has been it's been hard to hire, and they've relied on travelers, and even with that, they've been not able to accept all the patients. And then they backed up in hospitals, so the agency came back with a plan using travelers to open up more nursing home, step down beds. And so it's been kind of circular. I mean, theoretically, one would hope that the higher cost of travelers to stabilize and continue to provide the care should be recognized without our specifically telling them to do it. But I guess probably if you're a provider and you've got the protection of a certain amount of money, that's preferable from your perspective.
Yep.
I don't know. I wish I could, maybe before we finalize this on Tuesday, maybe I can have a conversation with Senator Lyons to see if Tuesday morning they want to, talk about this a bit more and give us a recommendation.
well, my biggest problem is that money will all leave Vermont. All those companies, most nursing homes are owned by out-of-staters. I don't know many here in Vermont, and boy, we shouldn't be exporting money.
But if the money's going to the workforce retention in the nursing home, then that's staying right in, well, assuming they live in Vermont.
That's a
it's
different
staying in
pot.
Vermont.
That's a different pot. That's a different pot, Dick.
Oh,
This would
okay.
be out of stabilization. So it's hard.
Oh,
It's
okay.
easy to get them, confused.
All
But
right.
I want to be clear that addressing the higher costs and the financial impact of traveler nursing on providers, whether it's nursing homes or VNAs or I don't know where else they might be hired.
Well, they're
Would
at
come out of
Depot Street.
stabilization.
Depot Street has travelers, but I think DCF is paying for them. But they have a number of travelers there, right? Until I think March 31st.
Yeah,
Just
that's
to
right.
augment the staff that they've lost. So I know, I think, it's a number of them, and that's huge cost. But I don't think DCF has put it into their rates. I think DCF is actually paying the whoever the organization is directly.
Okay,
But
Alice,
Just don't-
Alice, you had your hand up.
I'd like a little more discussion about the FQHCs. And are they anywhere in here? Or are they out similar to hospitals? I mean, some are not affiliated with hospitals. They're on their own.
FQHCs are reimbursed under a whole different structure. I don't know. I guess they could be eligible under that retention.
not the way the House has drafted it, but I don't know if they would have been eligible under the the administration's $15 million, door
Mhm.
essentially.
Okay. Maybe we should check on that. They provide more than half the primary care in the
Yeah.
state of Vermont.
If the hospitals were eligible come through the $15 million door, I would assume that the clinics would have been also.
I would think so too, but we can check on that.
Some are not affiliated with the hospitals at all.
Yeah, that's right.
Yeah.
Other comments? I'm going to talk to Senator Lyons and see, I'll talk to her over the weekend and see if she wants to just make time Tuesday morning.
So sorry to add to the burden, but the other consideration, just on the retention side, I think, because I think you're not talking about changing anything on the stabilization general fund, but the House did use ARPA dollars as the way to get up to the $60 million target. A portion was Medicaid. It wasn't meant to be braided. It was meant to target the independent care workers through ERIS and the shared living providers, because we thought those were the easiest to slot into Medicaid. But when you're considering this, are you considering a change in the funding sources and what your overall target is for funding? Because the $16 million of Medicaid came with a general fund match, and so we can leave it as plain general fund and allow the agency behind the scenes to match up as needed.
Okay.
But that plays into what your total pot of money is. What your
And you
target-
can't use the ARPA to be the match.
Right.
So we've got that to figure out.
Yep.
Unless we want to substantially reduce the amount in reserve from the 85 that's there to give us the capability to match federal needs out into the future, we have to use ARPA.
Yeah. And so
anytime we can match and get more federal money, isn't that better? And can we use the APRA funds for reserves? No.
Well, no, not in that way. No. And CRF you could use as match, but not the ARPA.
No, they've never allowed us to use anything in Medicaid match that was CRF or ARPA.
No, but we could in some places we could match it.
You could you could match it with FEMA. You could use CRF to match FEMA,
Yeah.
but there's been no.
I know
Medicaid
Medicaid is a pure state. I guess the question is, how much unencumbered general fund do we want to come into 23 with? And as it is, the House has 85, and with what we have, I wish we could make it an even 80. You said it's 5.32.
You could, assuming that you're not going to change anything, you could probably end up at that even 80, because I think there's still maybe 600 or 700 floating on the bottom line. So,
Okay.
we'll take a look at that. You're probably reasonably okay in that realm.
Okay.
We should bring as much forward as we can, because there's a new virus kind of started. I heard them talking about it today on the news, another one. But we aren't out of the woods yet.
No. Okay. Let me talk to, I think the general feeling is we would still use federal money to help with the workforce stabilization.
The retention.
I'm sorry, the retention. I'm sorry, I'm doing the same thing.
Yeah.
And it sounds like this committee is inclined to do retention and recruitment.
But has somebody figured out why we need 80 or 60 or 40? I mean, where did that number?
It's just what's available under the current forecast against what the entirety of what you have allocated or expended or appropriated for 22. So it's one-time money that's available given the current forecast in the general fund. And so it's simply the residual within the forecast amount of money available. That's what the dollar amount for that brought forward is from.
So
That's how
why
you-
are we spending it all then? I mean, just
We-
because it's available, we don't need to spend it, do we?
We're
Because
not
it's a-
spending,
You,
go
this is
ahead,
amount
Dick.
that's not spent.
It's a crisis,
spent.
Bobby. We have a crisis of retention of good workers in particularly social service programs. There are increased pressure from the population dealing with COVID, dealing with all kinds of other matters, and people are leaving in droves. And I think, I personally think it should all be used for retention, but if you all want to do retention and recruitment, I can live with it. But I think we don't even recognize the crisis we're in. Unless you're right in the middle of it, like I am on the DNA stuff. I mean, it is hard. If I had to come to Montpelier right now, I'm not sure I could get enough people to cover that I wouldn't have to commute every day.
Well, saying that, to just say we're going to retain what we've got when what you've got is inadequate and not giving any resources to
Right.
to recruit, and like a hiring bonus.
Yeah, I said I could live with some retention, but I want, I think it's also recruitment. I was more responding to the amount of money that that we're looking
okay.
at. Why 60 million? I was trying to explain it's a crisis. Yes,
Yeah.
some could be used for recruitment. I just got a little nervous when they started talking about going out of the country to recruit. That's all.
Okay.
Because,
Uh-huh.
one doctor from Germany is going to cost a lot more than recruiting somebody from Albany, New York.
So what are we putting into recruitment, Jane?
Well, right now, I think it's open. In other words, it would give flexibility in terms of what the split might be between what the applicant wanted to do for retention for current staff and what they would want for recruitment to fill vacancies. I don't think the House limited it just to retention, Stephanie, the way it's written.
The way it's written, it's retention. It has that flexibility for the employer to decide what is the best way to distribute the dollars among his employees. The grant award is based on that $3,000 or prorated amount per FTE. But once the grant is out at the provider level, it's the management of the providers that decide how to distribute that for retention.
Okay, so in essence, there's nothing available to recruit and fill vacancies.
It as I read it, it doesn't. The conversations that I listened to did not contemplate that.
All right. I think yes, Chrissy.
I just
We
want to
have-
let you know that Senator Campion has joined us.
Okay, so I guess the question is, do we want to allow the funds to be both? And if we do, which seems to be sort of where we're heading, do we want to just leave the 60 million open so that we have flexibility, or do we want to, then we get into, do you carve out a certain amount that you would say is available for recruitment and the balance goes to retention?
Well,
Or
I
do we
think
think
it's
just,
I would prefer the 60 million go, that retention and recruitment are allowed, that the employer would need to figure out exactly how they're
what
going
is
to
the
do it and
right
get approval.
combination? Yeah,
What is the right combination given their need? But it has to be a needs-based issue. I mean, my understanding is, for example, the group home that I used to work at lost 50% of their staff through attrition. So they need recruitment, but they also got to keep the 50%
Yeah.
they still have. So,
well, what they said, according to my notes, is what they would have is it would be variable and they would be using a needs-based formula.
right.
Okay, so I think
that
we've
would
come
be
to
good.
agreement that we want to allow to fund both strategies, recognizing you got to deal with your vacancies and you got to keep what you have.
Yep.
Okay.
Yes.
All right. Stephanie, we have Senator Campion waiting, and he can hardly wait to talk to us about CTE, I believe.
Yeah, thanks for having me. I appreciate
Well,
it.
welcome.
Where is he?
I'm in the apartment that I rent with you, but you're not here.
I know.
I know. Yeah, no, so I'm on my iPad while my committee is discussing Senator Nitka's bill on increasing the age of students staying in school. Senator Nitka, just so you know, the Agency of Education is not a fan. We're gonna have to need, yeah, we need to get you
I
talking.
bet the teachers,
What
Right.
I'd
I
like,
bet the teachers are in,
you know, these are children who are very challenging to have in school, and they have to do a
Yeah.
lot to get them into something that meets their needs.
Yeah, no, we're working on it. We're taking it seriously. We're hearing from a bunch of folks today.
Great.
And we'll let you know what we hear. But on the CTE front, we did meet this morning with the director, Mr. Farr, Scott Farr, who is one of the directors of the CTE programs, and he's been in regular contact with the other independent CTE programs. He took us through how they got to those numbers that the House put in, and feels supports those numbers. The committee feels good about those numbers. We didn't, I think the part that we was a little bit new to us was how tough recruitment was last year as it relates to CTEs. You know, they just couldn't get people in to take a look at the programs. They were using videos, they were using other methods to get people enticed into enrolling, and that just didn't work. So this really, these dollars keep them whole. It prevents them from having layoffs. It really, these hopefully are transitional funds, and the whole committee supports moving in this direction.
Now, Senator Campion, the problem
Yeah.
and you probably got the same testimony, was that the other non-independents had to work through their LEAs as supplicants to get money, and the LEAs didn't give them a dime. So they, even though they technically were eligible for it, they didn't get any money, and they experienced the same problem with recruitment. So what the House did was say, we'll make the independents, we recognize their need, but because you could have gotten it through your LEA and they didn't give anything to you, we're not addressing that. And so this committee was sympathetic to those CTEs that were not successful in getting any financial assistance through the LEA, and the majority of them didn't. As a matter of fact, I think maybe 2 or 3 got some money. So the administration had proposed 1.5 million to go across everybody. And the House just addressed the 3 independents. Did your committee take a position on the others?
No, all we did was Mr. Farr is going to produce a list for us to give us a sense of what's happening out there. And I know he's doing it for the House as well, for the non-independents. So we have a better idea going forward. And I believe the House is going to receive that list, and they are going to work on it in the big bill. That's all I have on that, I'm afraid.
So is the put a 1.5 million in instead of 500,000?
Well, then we would have to determine what we do. Then you carve out the 3 CTEs that are getting the $500,000, but according
you could do $1 million to the others and
You
do
could.
500,000. It's ed fund money, right?
The 517 is ARPA money,
not.
the 3. You could do it all in ARPA money for all of them.
Was the 1.5, is that what the governor, that's what the governor put in his recommend for the budget?
Yes,
Yeah.
to be distributed to all of them,
Okay,
all 17.
so equally. So I'm just
Yes.
wondering if, for example, some districts have already did get some money, what would that preclude them? Should this wait until the budget? Are they as in need as these 3 independents were? I mean, for
Well-
example, if somebody did get, if 5 of them have already received funds, I'm wondering if, would that mean they would get funds on top of the ones that they've already received?
Well,
I don't
that's the dilemma. That's the
Yeah.
dilemma.
We did get a report. Many of them did get some money, but not, it was like 70,000, something in that range. Some of those that had their own, some didn't get anything, as Senator Kitchell said, but I don't have the document right in front of me, but
I do.
Of course she does.
Jane has it.
You're amazing. It's amazing.
The Burlington
Did
Tech
you
Center
take
got
college,
money.
in college, did you take filing one?
Did I take what?
Don't even answer that. Filing.
Filing 101.
I didn't go
the
to
college course.
I did not go to secretarial school.
Right.
Although the quip was, you go to women's college to get an education, and you go to Katie Gibbs to get a job. That used to be the old saying back in the 60s. But we do have a list, and the majority of them got nothing. For example, Essex Technology got nothing, Cold Hollow, nothing, Green Mountain, nothing, Hartford Career, nothing, North Country, nothing. The River Valley, nothing, Southwest Tech, nothing,
Is this,
and Wyndham, nothing.
is that of ESSER money that they got? nothing?
No,
No.
I'm talking about, yes, the ESSER money, yes, Alice, that came through the LEA.
Right.
So we had 1, 2, 3, 4, 5, I guess. 1, 2, 3, 4, 5, 6. 6 got money out of the 17.
Jeez.
So, so they're in the same spot financially as the independents, because their LEA said, no, we're not giving you any of the ESSER money that we received.
It's terrible.
Yeah, I wonder why. Yeah, I don't have a good understanding of why the LEAs rejected that for the tech centers.
Because they wanted it all for themselves.
Yeah, they kept it for themselves.
I mean,
Yeah.
unfortunately,
Too bad.
they see them as competitors,
Because of local control.
So that was our concern was
Yeah.
not providing some recognition to, and then the question is, the governor was proposing that this should come out of the ed fund. Did you
Agree
take a
with that,
position
Governor.
on that?
We didn't. We just started, actually, we got the request just a couple of days ago, and we only had, I talked to the fella down our way, and then we had Scott Farr and Stephanie, and we're happy to do additional work on it if you'd like on Tuesday. But I think given what we've heard, I don't see the committee as being opposed to helping out the other CTE programs, particularly if there's a equitable way of doing it.
Okay. Senator Starr.
Yeah, Brian, why would the ones that got already received funds, why would we give them more? And why not fund the other ones, the 6 or 7 that didn't get any money? Why don't we fund them and bring them up to the level of what the others received?
Yeah, no, I think that's the right question. I'm just wondering if, I don't know what that creates out there in terms of disagreements among the others, or if like what you're saying, Bobby, if it's the right way to go. For example, if on average, the 5 or 6 that received them, they received 100,000, do we give 100,000 to everybody else? In a way though, are we rewarding those LEAs that did not use their money in that way? I don't know. It's a good question, but we're happy to dig into it if you want us to.
Okay.
Well, I don't know what the committee thinks, but we ought to be fair about where the money's going.
Well, maybe we can do a little calculation and get back and see if we put in a bit more money. Do you have a position about using Ed Fund to fund the CTEs?
We don't, we haven't even discussed it, but you're talking about doing the CTEs that did not receive any ESSER funds from their LEA?
Yeah,
14.
well, the governor the governor used the ed fund for all 1.5 million and
Yeah.
said everybody gets something.
Yeah.
The House put in the money for the 3 independents using ARPA.
Oh,
Wasn't it ARPA, I believe?
Yes, it was.
why
Yeah.
don't we
Yes.
from both funds?
So maybe
So,
there's,
yeah, if you want us to take a look at anything else, happy to, if you want us to, I mean, we'll take a look at whether or not it's the ed fund, but you're talking about doing that in budget adjustment?
Yeah,
that's what the administration was proposing, and that's why the independents came in with their request.
they really need it soon.
Yeah, there's no
Well-
need of giving them money after school's closed.
Yeah.
I'm all in favor of giving the independents what they need, but I think we should also try to take care of the others. So
Okay,
we can do the House version plus $1 million.
let's see what that looks like, and we'll discuss it on Tuesday and wrap it up.
Okay.
Okay.
Yeah, thanks. I appreciate coming in. I appreciate that. I disagree with Senator Ash. I don't think this is a committee that just shuffles money around. I feel like you guys do real work down here. I really do. I really do.
Thanks, Brian.
I just
Thank
Thank
you,
you,
Brian.
Brian.
Brian, we did pass the stabilization of household staff. So I think you're gonna be okay on that end.
Goodbye. Thank you.
Bye. Thank you. All right.
Say hi to
Um,
Harris for us.
Yeah, well, let's see what we can figure out if we put in an additional $1 million to see what that looks like. Okay. So we were going to adjourn at 3, but we had left from yesterday a discussion about what we do with S210 on terms of action and the interrelationship with the budget adjustment. We know based on the interpretation from David Hall that he has some question about the whole legality of moving the 5 million that we put in the budget bill that didn't go with the program that was created.
Right.
And so that's why we got into the discussion around putting policy and putting the money together. And so we have a bill that has the policy and it has the appropriation at a recommended amount. And then we have the budget adjustment that also has funding for the Vermont Rental Assistance Program. And we were pretty much, I believe, saying we need to deal with the legal issue that our legal counsel, David Hall, has related to us about you have to have an appropriation that has money to go with it. I suppose you could argue, well, it's federal money, so only their rules need to apply. So we kind of left it yesterday, and we've had some follow-up discussion with economic development, Senator Sorokin, and the general feeling at this between the discussion was that we really don't want to repeat last year's experience, that we want to put the money and the policy in one place and in one bill.
Yeah.
And the logical place to do that is S210. And yes, there is a timing issue, obviously, to move it out quickly so that the money that's appropriated through S210 is available. I believe Senator Sorokin told me that he has talked with the chair in the House, and they're prepared to take action very quickly on the bill so that the release of the money and the appropriation could be done upon passage, and therefore would move it out to keep the program going. So that's with that work that has gone on since we left this discussion yesterday. We would have to make an amendment to the S210 on the appropriations sections to do exactly this. So in anticipation of this discussion, David Hall has drafted what an amendment to S210 would look like to achieve the goal of putting money and policy in one place. And so I just want to say we can look at the amendment and then take action, but I want to give the committee an opportunity to respond, because obviously if we move the bill out today, you're going to have to vote on it. So Senator Ballard, did you have something to say?
I'm fully supportive of that. I think the money and the policy need to go together, and it never should have been split to begin with. And so I'm completely supportive of that.
Okay. Senator Baruth?
Same here. I think that's the elegant solution to it.
Okay. And certainly people want the benefit and the money to go out timely. And so if we have the commitment on the House side to do that, then it seems like the appropriation would travel just about as quickly through that bill as it would through the BAA. So that means we need to take a look at what amendment we would need to make to S210 to deal with the appropriation. And you have that, Stephanie? Stephanie? Chrissy?
Yeah, I am here.
Has David Hall joined us? I did talk to him earlier in the day that this might be coming, and he said he would have the amendments ready.
And I just shot him an email and as well, asking if he had a document to share. So I made it a high priority. I haven't seen anything yet, so.
I haven't received anything in my email either from him. But it was adding the appropriation of $20 million, but also correcting the source funding for the other two appropriations that are in the underlying bill.
I thought it was 12 million in the underlying bill, so we're
It
increasing it
was,
to 20
but-
million.
But in the budget adjustment, the House had wanted to put in 20 to get more units brought online and to fund it out into the future. So what we are doing is taking what was in the House passed budget adjustment, which we did, that was part of my discussion. And the agreement was to concur with the House on the amount, but not to put it in the budget adjustment as the vehicle for the appropriation.
All right.
So that you're right. That's what the amendment would do, is change that amount as well, Senator Sears. Did David Hall take the afternoon off?
No, his calendar looks full. I just sent him a calendar invite as well, so we could get into the meeting if he is available. And I'm going to reach back out with another email.
Okay. While we're waiting, Stephanie, did we get any rewrite around the language to protect people who get a retention payment or whatever from counting on their benefits, if at all possible?
It's not a rewrite, it's adding that. I mean, we're going to redraft the entire section on retention. And so it would be included in that.
Okay.
The same directive that we, to the extent possible, we would want these not to count, to influence the benefit levels that people have. And so if it's a one-time payment, it should not impact many. It may impact childcare.
Taxable, right?
It will be. So the grant would go to the employer. The employer would make the payment to the employee. The employee, that would be it would be.
It probably would, just the same
Yeah.
as the hazard pay, but this is for benefits like food stamps and Medicaid and
Even
public
childcare and-
assistance,
yeah.
childcare. Oh, yes, I see David Hall.
David's joined us.
All right, thank you. David? Oh, hi,
Hi,
David.
good afternoon.
Hi, and Stephanie spoke to you earlier in the day about amendments for our consideration.
Indeed. I have sent it to the members of the committee as well as to Chrissy and to Steph. So I hope that you all have it or can access it in your email or on your webpage. Any luck there?
Not yet.
I can also share my screen if you would like me to do that.
That might be the easiest thing to do if you would, David.
No problem. So are you seeing the amendment on your screen now, I hope?
Yes. Uh-huh.
Great. So there's a few things going on here, a couple of instances of amendment. And the first one is to strike out the sections in the bill, sections 4 and 5, where the positions are authorized, because currently in the underlying bill, in those sections, the positions are authorized and that's where the money is appropriated. And I've pulled all the appropriations into one section at the end of the bill.
Okay.
So this rewrites 4 and 5 to authorize the positions, but again, the actual appropriation of the dollars will be later.
All right.
And it's the same principle. It's an authorizing the maximum number of positions, which is 5 in DPS and 1.5 in DHCD, but the funding is just one-time startup for part of that cost, and the rest of the staff would be hired and funded through the fees that are collected through the registration process.
Okay.
So that's the second instance of amendment where I am striking out, Senate Economic Development's appropriations of $2 million and $10 million for the rental housing investment program. And in place of those, putting a single appropriations section that has all of the money all coming from the ARPA funding source referenced on lines 15 and 16 here. We have been asked to include a statement of, basically the nexus of ARPA spending to ARPA allowable uses. And this is, so the purpose section here in subsection A is just sort of some stock language about the purpose of the appropriation. So I put that they are to respond to the public health and negative economic impacts of the pandemic, and to ensure that Vermonters and Vermont communities have an adequate supply of safe, affordable housing. So that is for all of this spending, all related to housing and housing safety. So subsection B has the actual appropriations in it, again, from the ARPA funds. It's $100,000 to DPS, as before. It's $300,000 to DHCD. It's $20 million to DHCD to implement the rental housing investment program created in 10 VSA 699. So that's the money, and then the effective dates are a new section 16.
I would like to make the effective date, well, I don't know, can we, the appropriation and the rental assistance, is it possible to make that upon passage?
They are.
Yeah, they are.
Well, they are in your version, yes.
Okay.
So the way, just, I guess for the record, the way this would work.
Oh, I see at the top. I'm reading it just now. Shall take effect upon passage. All right, thank you.
Yes. So this does differ from the underlying bill as far as these sections now being on passage instead of in July.
All right, thank you. So you've kind of reformatted it and put the appropriations and the positions all in one place. I think you can take it down. Take it down. Okay, so I guess we have a meeting at 3:30. Is that right, Stephanie? I thought it was full.
I think it's at 3:30 on the Medicaid waiver.
3:30.
Okay, all right. I've got 15 minutes before my next meeting. So we have the amendment to do what I had said was to start up the Vermont rental housing investment program and make the funding available on passage. Any questions the committee has of David? Yes, Senator Baruth.
I was wondering if the chair would entertain a motion.
Oh, I certainly would to accept the amendment.
Exactly.
Who's our clerk left? So,
Oh, I am the clerk.
Oh, you are the clerk. I'm sorry.
He's the
sorry.
And there's coups everywhere. Somebody's trying to take my clerkship.
I'm sorry.
We'll have to put you on a retention bonus.
I know.
Oh my God, I'll have to put you in my filing cabinet.
I'll
Okay,
stay for
so our
$12,000.
clerk has moved to amend, to approve the amendment to S210. Do you want to do it as a combined amendment to move the bill favorably as amended?
Sure.
You don't want to do it that way, Senator Sears? I can't, you're muted.
Muted.
I'm tired of muting and unmuting. I got people making noise. I thought you had to do it separately because it's an amendment.
Okay, then we
to the
will.
bill.
All right, we will.
But to make clear, I'm voting for the amendment. I'm voting for the bill to get it out of here, but I may not vote for the bill on the floor.
Okay, I understand. All right, we have a motion to approve the amendment. A second?
Second.
Okay, all right, will the clerk please call the roll?
Senator Ballant.
Yes.
Senator Baruth, yes. Senator Nitka.
I'm voting for the bill to get it out of here. I may not vote for it on the floor. I do support parts of it strongly and another part not so.
So do you vote for the amendment?
Yes.
Okay.
Senator Sears.
Is he frozen?
Senator Sears.
He's frozen. Oh.
He just did a thumbs up.
I'm frozen. I don't know if that's a vote or not.
Yes, now you're thawed.
Okay, Senator Starr.
Yes.
Senator Westman. Senator Kitchell.
Yes.
And Senator Westman is no longer in committee. So I believe that's 6-0. 6-0-1.
It's 601. Now I would entertain a motion to move the bill favorably as amended.
So moved.
Okay, Senator Ballant's moved to move the bill favorably as amended. Could I have a second?
Second.
Okay, Senator Nitka. And the clerk?
Senator Ballant.
Yes.
Senator Baruth, yes. Senator Nitka.
Yes.
Senator Sears.
Yes.
Senator Starr.
Yes.
Senator Westman. Senator Kitchell. Senator Kitchell.
Oh, yes.
And Senator Westman, again, not present, 6-0-1.
It's been a long week.
Does that conclude the? Does that conclude the?
Oh, I see. Chrissy's
now
got.
We need a reporter. We need a reporter. Who does housing? Who does ACCD?
Maybe it's me.
Oh, it might be.
Might be me. Okay.
All right. if you want, I can report it. But if I can't
I'm happy to-
remember.
I'm happy to do it, Jane. It's fine.
Okay. All right. So Senator Ballin believes that that is her section of the budget, and she'll report the committee's vote and the amendment that we're offering. Okay. Thank you. So this is the end of our agenda today, and I'm going to adjourn the committee.